Glaucoma is also called the sneaky stealer of sight or the silent blinder. It has earned this reputation by its gradual, creepy way of coming upon us. It's one of the leading causes of blindness. In fact, glaucoma is the #1 cause of irreversible blindness worldwide. Most times, there are no symptoms of glaucoma. By the time you develop symptoms, say for instance, loss of peripheral vision, the condition has progressed far already. On occasion, one particular type of glaucoma would cause sudden severe pain in the eye with blurring of vision and headache. Glaucoma generally results from damage to the optic nerve. The optic nerve is that big cable that sits behind the eye and transmits signals from the eyes to the brain. So as you would imagine, damage to that nerve over time would eventually cause problems with vision. And there are a number of factors that can cause this damage. Although today we're going to be focusing on just one, which is perhaps the most common reason for damage to the nerve, and that is the high pressure inside the eye. The interesting thing is that the pressure inside the eye can be measured, so affording us the opportunity to detect glaucoma early. As suggested earlier, anyone can develop glaucoma, although your risk is generally higher if you have a family history of glaucoma, if you use prescription glasses like myself, if you've had previous eye injuries, or you're on certain medications. Untreated, glaucoma could lead to blindness, and the treatment is usually very simple. Most times it involves the use of one or more eye drops that you can usually get prescribed to you by your eye specialist, and usually you have to use these drops for the rest of your life. Sometimes laser treatment or eye surgery is required. However, early detection remains the best option, and we can achieve that by checking our eye pressures every 2 years, and if we have high risk, then even annually. Should you develop sudden onset of pain in your eye with blurring of vision and headache, then you need to seek emergency attention immediately. Ultimately, you do not want to be caught unawares by glaucoma. So please, check into your nearest eye clinic and have your eye pressure measured. It's important you note your reading, note your number, and that way you may begin to preserve your sight.